Good afternoon. My name's Emma King. I'm the CEO of the Victorian Council of Social Service. I'm really interested in terms of furthering on from your comments, Minister, in terms of the government's role in job creation. Particularly, you talked a lot about business and community sector, and I entirely agree that we need to work together. But particularly given, I guess there's two parts to my question. One is government's role in job creation, particularly in regard to young people and the escalating youth unemployment that we're seeing at the moment. And the second part is, I guess I do want to voice my concerns around the draft or the interim report and the tiered payments, particularly looking at smaller payments for young people, knowing that unfortunately the cost of living are not less for young people. So to get your thoughts on both of those would be appreciated. Thank you.
Well, I suppose my starting point is that governments don't create jobs generally. I mean, we do in the public service, but generally we don't create the bulk of jobs in the country, businesses do. And so having a vibrant economy is the key to ensuring that we have more jobs, and I think that's just a given, basically. The difficulty of youth unemployment in particular is that it's a persistent problem, but there is often great disconnect between jobs being available and youth unemployment. And to give you a very typical, indeed topical example, if you take northern Tasmania, there are jobs going in the horticultural and agricultural sector where producers simply can't find people to do the work, and they import backpackers and anybody else that they can to do the work. And yet this is a part of Australia where we have one of the highest youth unemployment levels of any region in the country. So there's a clear disconnect between the need for jobs, the availability of employment on one hand, and yet high levels of youth unemployment on the other. And somehow we have to work at ways which are going to overcome that. And in many of those areas, we're talking not just about first generation unemployment, we're now talking about second and indeed third generation unemployment. So it's not a simple answer to this, but it's something that we need to tackle, and that's why we're looking at these issues. In terms of the tiered payments, one of the challenges, I think, of the welfare system is that we've tended in the past to treat people as one homogenous group. And if I can just use an example of the New Start recipients, the reality is that half of the people who are on New Start leave New Start within about 6 months. In other words, they use it as a temporary measure to tide them over between finishing education and getting a job, or more usually between finishing one job or ending in one job for whatever reason and getting another job. So for that group, there's a high level of motivation to go and get a job, and there's probably accompanied by a reasonable level of skills which will enable them to get the job. Yet we know that there's another group of people growing in number who are long-term unemployed and really shouldn't be treated exactly the same as the short-term unemployed. So the idea that we just treat everybody as one similar homogenous group of people, I think, is a flawed way, and we need to start delving into who they are. Now, this is why I'm particularly keen on the New Zealand investment model, because what they've done in New Zealand, if you just take welfare, they have in effect, using actuarial data, broken their welfare cohort into, I think it's now about 19 or 20 sub-cohorts of that. And you're getting closer to an individualised response depending on the cohort. And to use the cliched example, if you have a young person, aged 18 or so, left school as soon as he or she could leave school, therefore hasn't completed his or her secondary education, has not got skills to get a job, is on welfare, and frankly, if nothing changes, is likely to remain on welfare for some considerable period of time, let alone end up being addicted or incarcerated or whatever. They've said in New Zealand, well, for that cohort, that sub-cohort, what do we need to invest in that person or that group of people that will lead to a trajectory where they're going to have the skills, they're going to have the chance of getting a job, and therefore be positive and beneficial for them, their families, their community, for the country, versus where they are now, which is this trajectory of welfare dependency. And their actuarial work shows that if you've got that person in that cohort at the age of 18 or 19, there's a 70% chance, if you don't do something about it, they'll still be on welfare at the age of 35. Now, I think this is a much more intense, closer to individualised response rather than treating the group as just one homogenous group of people. Now, to get to that point is not easy, and there are some advantages that New Zealand has, like one level of government rather than two, even in terms of collecting data, so you can make the actuarial calculations, etc. But as an objective, as where we should be going, I think they're closer to a more responsive, flexible, modern welfare system than we are in Australia at the present time.
If I could just add, it's forget the All Blacks for a moment. It is my honest opinion that right now, on just about all criteria of innovation, if we put the New Zealand public service against any Australian public service, the New Zealand public service would win hands down. The amount of innovation that has happened in the last 3 or 4 years is extraordinary. And the irony is this report, which is these successive reports that have been done in New Zealand about the cost of someone being on welfare and why you need to invest. The irony is, of course, it was done by a consultancy firm from Sydney. But they did it and have used it and have implemented it. There's a message there. In terms of the major issue about employment, my view is somewhat different. My view is if you're unemployed, you have an entitlement. You have an entitlement to an unemployment payment. You have an entitlement to it straight away. But my view is that it comes with an obligation, and the obligation also cuts in straight away. So I have absolutely no problem from the day that someone receives their unemployment benefit that there are obligations, either to find education or to get training or to go to work or indeed go to a work for the dole scheme. Because I did administer many of these schemes for the previous government, and some were not very good, but most I visited were highly effective. The argument used about work for the dole was, well, you didn't get any skills. Can I tell you, turning up to work on time and understanding how to operate at a workplace for many is a soft skill which is absolutely vital to employers. So I had no problem at all with the fact that immediately your entitlement cuts in, your obligation cuts in. Myself, I wouldn't have a delay in that regard. The other thing is I am, of course, concerned about the high levels of youth unemployment. And I think we have to think how to prevent that. Now, I am, in one of my guises, the Chancellor of the University of Western Sydney. I think we're the university that has the highest proportion of low SES students. We're running at about 25%. Universities overall, I think, are about 16%. But it doesn't just happen. It's not a matter of reducing scores. We've achieved that by working with a large number of public and Catholic schools, and we work with students from year 9. And the reason we work from year 9 is if you don't, for many of those students do not actually come from an environment, particularly if you come from a welfare environment, that understands these are your prospects and what you need to get employment. We encourage them to do vocational education. We encourage them, if they can, to do university education. It's highly successful, but in effect, I have to tell you, there's 4 years of investment goes into getting that outcome to get people to stay to year 12 and know what to do after year 12.
Thanks. Sorry. Yes, Peter, and obviously we would agree with you. In fact, at the Smith family, we start even younger than year 9. We start in the primary years on that trajectory. So there's a couple of questions over here. Yes, thank you.
Julie Edwards from Jesuit Social Services. Just picking up the last point, Peter, that you made, it would be very much our experience too about the investment that one needs to make in terms of keeping people connected, and school, as we know, is one of the great institutions that we need to keep young people connected with, but also our own experience in establishing Jesuit Community College for people who have incomplete schooling, or the social enterprises that we've set up, is that there is a great investment that needs to be made in terms of, first of all, often it's engagement, and then it's about flexible packages, etc. Where do you propose in this scheme of things that the funding for such interventions would come? Because it doesn't come attached to the education dollar, and it often doesn't come attached in terms of the employment outcome. I'll clarify what I mean by that. Job Services Australia, for example, currently get an employment outcome, but organisations in the community who are actually doing that grounded work don't get those funds, which are about the engagement and the wraparound that we actually have to invest in to keep people connected and to get the good outcomes.
Well, I'll leave the Minister to answer the government, but let me just take Job Services Australia or Job Network as it used to be. I think this was an extraordinarily important initiative from the mid-1990s. There is no doubt from any of the reports that I have seen that if you look at the outcomes, and this was a scheme that was meant to pay by outcomes, getting people into work for 13 or 26 weeks, it's been achieved more efficiently and effectively than the old CES 50-year-old government monopoly. It's worked. My frustration is that the original vision that I think the Howard government had hasn't been fulfilled. And it hasn't been fulfilled in part because of what I've been talking about, that it hasn't been based upon a collaborative or partnership model. It's been based on an outsourcing, contracting model and just pay for outcomes. So, and as a result, the amount of red tape associated is now far, far, far greater than it need to be. When you talk about your issues, it seems to me that one of the things that we could start to do is to get bit more sophisticated with our model. We know there are particular groups where it is particularly difficult to get outcomes. Particularly difficult with people who've been long-term unemployed, and if you peel away long-term unemployed, they're often the children of a parent who's not been unemployed, Aboriginal and so on, people with a disability that the Minister quite rightly focused on. I think we should do far more at being willing to contract out delivery to specialist organisations that really can work and introduce their own way of trying to get people into employment. Because I think then you'd get the sort of innovation that actually the Smith family is doing in terms of thinking, well, if we're being paid a different sort of outcome rate to really tackle the hardest group of long-term unemployed, actually we think we've got a model, and this would be a chance actually to scale it up and trial it. My final comment is that governments tend to use pilots in the wrong way, and I think we need to use them in the right way. Pilots often come about because one department or one minister has a really good but courageous idea that seems really good, but Treasury or Finance don't want to fund it. And so the way you get around it is say, well, we're not going to roll it out nationally, but we'll do a few pilots. But you do those pilots never thinking you're going to roll it out. It's a way of reducing the cost. I think here is a real opportunity to say we do want to do demonstrations. There are all these thorny issues we have in social services that we haven't got a solution to. Let's fund different organisations to take different approaches to doing things. That, I suppose, is why I'm so enthusiastic about social benefit bonds in New South Wales. It said to two organisations, well, you reckon you've got models that work? You've got skin in the game now? See if they do work. As it happens, it seems to be that they do. But I think that sort of approach, rather than a single national Job Services Australia model, might be a way to go.
Julie, I'd just add that this is always a work in progress. There's not some magic way in which we can achieve a final outcome. One of the difficulties of government is that as much as we try to fight against it, there is a siloing effect in government. So what you're describing is an example of that. So I might be trying to do something in my portfolio, but unless I can get the employment services portfolio to take a similar approach, let alone any others, let alone the state and territories, then there is difficulty as to what you can finally achieve. So I suppose I've always been a sort of pragmatic incrementalist so far as government is concerned. Not about grand visions and big announcements, but by just trying to start things and nudge it along in the right direction. So to give you an example of that, which I think picks up your point, one of the things we're doing in the portfolio is to work on a sort of overall strategy for prevention and early intervention. Now, when you talk about that, people think about early childhood, obviously, because that's where early intervention is most talked about and utilised. But we're looking at this across the life course. So, are people prepared for? You can pick different points, but are children prepared in a way which they're going to be secure and have an ability to be nurtured and be able to learn? Are they ready for school? Are young people ready for just starting to learn some life skills? Are they work ready at the end of school, to pick up your more specific point? Are they relationship ready to form a healthy, stable relationship? And then you can go right through, are people ready for retirement, and are people ready for ageing and old age, etc. So you can apply a preventive early intervention strategy across the life course by picking different events. And my hope with this is that whilst it's happening, will hopefully happen in my portfolio, if the rest of government can see that there are advantages in that, then we can start to join up with other services and other things as well. And so the combination of a social investment, an early intervention and prevention strategy, and measuring outcomes rather than counting inputs, which we traditionally do in government, hopefully they will nudge where we want to go in the right direction.
And if I could just add to a very modest minister, he fully understands this demonstration project. So I think one of the ones he's doing in aged care in South Australia to try and demonstrate new approaches is precisely the sort of approach that I've been suggesting.
Fantastic. Well, we have a question up the back and then down the front here.
Thank you very much. Good afternoon. Melina Morrison from the Business Council of Cooperatives and Mutuals, and good afternoon, Minister and Professor Shergold. Minister, you gave a very strong argument for looking to New Zealand's investment approach in the area of employment services. There's an area where New Zealand is looking to Australia at the moment, and that's with your government's interest in public service mutuals, as evidenced in the foreword to the Public Service Mutuals white paper that you launched at Parliament House in September. In November, the New Zealand Treasury has invited the Business Council of Cooperatives and Mutuals and UK representatives from the Cabinet Office to talk about the role that public service mutuals, cooperatives and mutuals can play in public service delivery. And that's because they're specifically looking at whether cooperatives and mutuals are a good private sector partner for government in terms of being able to deliver consumer-centric public services, that where we bring both citizens and civil society together in the same organisational structure. I wonder, Minister, given your interest in public service mutuals, if you could talk about how you see the role of cooperatives and mutuals in delivering public services in Australia and how that relates back to the beverage ideals that you spoke to in your opening address.
Thank you. Briefly, I don't think Lord Beveridge actually set out to establish what we have today.
No, he didn't.
I think he had a different view in mind, and it was building upon the great tradition of mutuals and cooperatives that existed. And if you think about Australia, going back to the late decades of the century before last, of the 1880s and 90s, we had burgeoning mutuals in Australia, both in terms of financial institutions, in terms of health support, in terms of building societies, etc. Indeed, at the time of the First World War, I think about 1 in 4 Australians were members or beneficiaries of some sort of cooperative or mutual organisation. And one of the unintended, I think, consequences of the welfare state particularly from the Second World War onwards, was that it took that turf largely from many of those mutuals. So there is advantage in rebuilding it again, because I think that was actually part of what was envisaged in the first place, not to supplant them, but to add to them. But also, secondly, I think it's important because it does the sorts of things that Peter Shergold was talking about in his address. I'm looking around to see if I can find one part of my portfolio responsibility where there might be an interest in actually starting this. I've had a couple of little snippets of interest, and I'm being very encouraging of those parts of my portfolio that want to explore this to do it if they think it can work.
Just on Lord Beveridge, because I've read his papers in some detail, the interesting thing is with Lord Beveridge is that he did see a potential danger to the creation of the welfare state. He specifically saw there was a danger in what he was proposing in creating a culture in which people would become dependent on the state. He said, I don't believe this is going to happen, but there is this danger. So he foresaw a potential, and I think that's part of the things that we and other countries with welfare states are struggling with. In terms of public service mutuals and cooperatives, a bit like social benefit bonds, I think they are, they're certainly not a silver bullet, but they're a very interesting concept. And if you look at the Cameron agenda in the UK under Big Society, you can see a number of instances there where groups of public servants delivering things like library services, baby health services, have actually created their own companies and are now doing it in their way. We've never done this, but when we set up Job Network, if you then, as I did, went to visit many of the organisations that won the contracts, it probably wouldn't surprise you that 90% of the staff had come from the department. They'd previously been working from the CES. In effect, what you got was almost that public service mutual. There were groups of public servants being recruited into these Job Network members to deliver the services in quite different ways. So I absolutely think it has potential.
Thanks. Rosemary had a question down the front here. We might have to make this the last question too, I think.
Thank you, Minister and Peter Shergold. I'm going to introduce another issue into the debate, and that's health. I'm from the Mitchell Institute for Health and Education Policy, a very new think tank in this space, and we're looking at the issues that most perplex policymakers in health and education. And no one in this room will be surprised that the people who carry the greatest weight of ill health in the community in the contemporary world are those of low socioeconomic backgrounds. Similarly in education, you've talked about early childhood and the notion of prevention and early intervention there around engagement in social and productive activity. It's also so of health. I've just come from a conference across the way on international health priorities where I gave a talk about health, which is almost a mirror reverse of Peter's, talking about what needs to change in the way in which we think about health if we are to achieve better health for a population and not a sense of dependency on an illness supportive system, but changing our health system to one that enables health rather than responds to illness only. I wonder what you would both think is the potential to broaden, as you can, the debate, to see the savings and the benefit of investment now, not just in welfare, but in the health and productivity of our nation.
I think that would be desirable to do, Rosemary. I suppose coming back to my point that I'm a pragmatic incrementalist, you've got to start somewhere. And whilst not everything, it happens in New Zealand, we would necessarily follow, but I think in some areas, as Peter said, they've been much more innovative, partly because I think they are a small country and have an ability to do it that we don't. But if you look at that social investment model, they're now starting to apply that to other areas. So, and interestingly, the biggest fan of the social investment model in New Zealand is the Finance Minister, Bill English, because he can actually see when you measure this over 10 or 15 years rather than just the 3 or 4 years of the forward estimates, they can see what the advantage is, and they put it into their budget each year now as to what the saving is in the medium to longer term period for New Zealand. Now, there, I was with him for some time about 3 months ago, and he told me that they're now looking to apply this to other areas. So they're going to apply this to, as best they can, to homelessness funding. So again, what are the cohorts of the homeless? They're going to be very different. Someone who's young and homeless because marital family dysfunction may be entirely different to somebody who's in their mid-30s who's suffering addictions, you know, whatever. You can think of whole lots of cohorts of homeless people. So again, they're going to apply that as well. They're also going to apply it to incarcerated people. And if you think about it, that's a great opportunity, because you've got some young person who did something stupid at the age of 19 or 20 but hasn't got many skills or qualifications, we're going to be locked up for the next 2 years. Well, there's a great opportunity to actually help them get the skills that they need, so A, they won't get locked up again, and B, their trajectory is one to being a contributor to society rather than somebody who's in jail. So once you embed this idea in some area, I think the value of it will be seen broadly across government, and you could therefore think that, well, if you can do it in welfare, or we can do it in homelessness, or we can do it in some other area, we can do this in health as well, and I would see this as hopefully the consequence of getting it started.
I concur with what the Minister said. All I would add is that I do see at long last a change happening. You know, when I look back on my 20 years' experience as a public service, the fact was, as now, that most of the funding, Commonwealth and state, that went for social services was dealing with crisis management. That's where most of the funding was going. And if you brought forward programs that were designed to be preventive, the difficulty was finance tended to see them as expenditure rather than investment. What we are learning is that we need two things. The first is evidence-based policy, and I have to say this is where I think New Zealand has led, because New Zealand now has built up under Treasury this set of data which shows very clearly what the costs are if you do not intervene early, and that is helping to change government policy. And what it means is, for Treasury, they are now the biggest enthusiasts. In New South Wales, where did social benefit bonds come from? They didn't come out of Family and Community Services. They came out of Treasury, and Mike Baird as Treasurer. Now, of course, he's Premier. But the key here was, the second thing you need is not just evidence-based policy, but you have to have metrics. If we're to convince governments and treasuries that this is a real investment, you need to be a way to be able to measure over 3 or 5 or 7 years what is the benefits of that. Now, can I tell you that's a real challenge for public servants, and it's often a real challenge for civil society organisations. Because when we started doing out-of-home care initiatives in New South Wales, the department said, we've got so many statistics, you won't need anything more. So our first question is, so what is your estimate of what the level of out-of-home care is going to be in 3 to 5 years without any additional intervention? Because that's what we're going to be paying outcomes on. Of course, they had no such information. It's a different sort of evidence. You have to build counterfactual evidence. And so that is what's happened. So in that instance, it doesn't have to be a bond. You can deliver this service in other ways. It's a matter of saying, well, if we invest, we can prevent these additional costs. We can measure what these additional costs would be without intervention. We can pay civil society organisations on the basis of the extent to which they are able to reduce that level of anticipated future costs. I think this is really quite an exciting new world.